show you a table how to remember all the drugs, and then we will do drugs individually. So we are doing list of psychiatric drugs and what are the uses and what will happen if you overuse them. So we start with antipsychotics. Then next is your atypical antipsychotics. Next is your lithium. Next, buspirone. Next in line is your SSRI. Then you have your SNRI. Next you have your Tricyclic Antidepressants. And then you have your monoamine oxidase, MAO inhibitors. And last we have your atypical antidepressants. So antipsychotics are used to remember, that is, they are used for schizophrenia positive symptoms, Tourette, mania and psychosis. Antipsychotics use and its side effects. It can cause muscarinic side effects, it can cause extrapyramidal side effects, it can cause endocrinal side effects, and it causes QT prolongation. Atypical antipsychotics are used for that is schizophrenia, Tourette, mania, bulimia, generalized anxiety, OCD and depression. Atypical antipsychotics will do what? Side effects will be, it can cause increase in prolactin, risperidone, it can cause agranulocytosis, it can increase weight and can cause seizures, and it also does QT prolongation. Lithium is used for BMS, that is bipolar, mania and SIADH, and its side effects include MNOP. MNOP will stand for movement, that is tremor, because it is used for SIADH, that is increase in its ADH, it will decrease it and can cause nephrogenic diabetes insipidus. It can cause, O is for hypothyroidism, and P, it cannot be used in pregnancy, it can cause Epstein anomaly. Buspirone is used for generalized anxiety, and so far nothing here. SSRI, selective serotonin reuptake inhibitors, are used in most of the psychiatric problems, which list I have already given you. But what can it cause? Its uses are plenty. What it causes is, if you use SSRI, it can cause serotonin syndrome because it is increasing the serotonin, but other than serotonin syndrome, it can cause SIADH, it can cause sexual disability, and it can cause GI disturbance plus serotonin syndrome. It can cause sexual disability, it can cause SIADH, and it can cause GI disturbance. SNRIs uses, and its list I have already given in the previous video. SNRI can cause SBN, that is, it can cause sedation, it can cause increase in blood pressure, and can cause nausea. Tricyclic antidepressants are used for that is migraine, it can be used for depression, it can be used for peripheral neuropathy, diabetic peripheral neuropathy, it can be used for OCD, and it can be used for chronic pain. Now, side effects will include it can cause sedation, anti-muscarinic side effects, anti-adrenergic side effects, plus it can cause coma, convulsion and cardiac depression. FQR, it can cause fever, QT prolongation and respiratory depression. MAO, used for atypical depression and anxiety. They can cause, because if you inhibit the MAO, what will happen? It will increase the tyramine and that can lead to hypertensive crisis in people who are taking tyramine food, that is cheese, etc. Atypical antidepressants are 3: mirtazapine, trazodone and bupropion. Mirtazapine, trazodone and bupropion. Mirtazapine, all of them are used as atypical antidepressants, can cause side effect, that is it increases the cholesterol, it increases the appetite and it can cause sedation. Trazodone can cause sedation, postural hypotension and priapism. And bupropion can cause insomnia, headache, tachycardia and can cause seizures if taken in high quantity. So these are the different psychiatric drugs, their uses and their side effects.